Welcome to Vetted Health News. I'm Dr. Felicia Stoller. Vetted Health News is a multimedia brand providing health and lifestyle news that is entertaining, but more importantly, it is substantiated by science. Our mission is to critically examine and deliver unbiased health, medical, and lifestyle information with the same journalistic integrity as hard news, politics, and current events. You will find us here each week giving you the skinny on topics that affect our lives. Each show has recurring segments exploring mental health issues, the politics of health, common health myths, and even the utterly ridiculous as it relates to your health and well-being. We want to hear from you. Send us questions or comments about something you'd like us to discuss or explore. We'll highlight topics important to you, so reach us via Twitter, Facebook, or through our website. June is Eye Health and Cataracts Awareness Month. Some say the eyes are the windows to the soul, but really, they are the window to our body's health. Chronic diseases like cholesterol, congestive heart failure, atherosclerosis, and even diabetes first appear in the eyes. Other conditions impact vision from pregnancy to AIDS, malaria to lymphoma, and a host of other ailments. There is literally an A to V list of ailments and disorders of the eyes. Most parents know about conjunctivitis or pink eye. We've heard about glaucoma and cataracts, perhaps color blindness, dry eyes, macular degeneration, retinal detachment. How well do you know your eyes, and how often have you gotten them checked? The bigger question for you may be, who do you go to? First, let's look at the three types of O's. An optician is a technician trained to design, verify, and fit eyeglass lenses, frames, and contact lenses to correct eyesight. They use prescriptions written by an ophthalmologist or optometrist. They do not test vision or write prescriptions for visual corrections, nor are permitted to diagnose or treat diseases. Optometrists are healthcare professionals who provide primary vision care ranging from sight testing and correction to the diagnosis, treatment, and management of vision changes. An optometrist is not a medical doctor, but does receive a Doctor of Optometry OD degree after completing 4 years of optometry school preceded by a bachelor's degree. They are licensed to practice optometry, which primarily involves performing eye exams and vision tests, prescribing and dispensing corrective lenses, detecting certain eye abnormalities, and prescribing medications for certain eye diseases. An ophthalmologist is a physician, a medical or osteopathic doctor who specializes in eye and vision care. Ophthalmologists differ from optometrists and opticians in their levels of training and in what they can diagnose and treat. As a medical doctor who has completed a college and at least 8 years of medical training, an ophthalmologist is licensed to practice medicine and surgery. An ophthalmologist diagnoses and treats all eye diseases, performs eye surgery, and prescribes and fits eyeglasses and contact lenses to correct vision problems. Many ophthalmologists are also involved in scientific research. I recently had the opportunity to sit down and speak with my friend and ophthalmologist, Dr. Sarika Kallur.
Imaging has really changed everything in ophthalmology. We have ways of taking images of the retina so we can document how things look and monitor it carefully. We have something called OCT, which is ocular coherence tomograph, like ultrasound, but we use light. The light passes in, hits different layers of the eyeball, and we can take images up to a few microns in detail. So for macular degeneration, retinal hemorrhage, edema, or glaucoma where there's nerve thinning, we can actually document these layers and sort of watch to see this progression or not. So instead of having to inject and put dyes, we can actually look at the layers. So we can catch disease earlier. So from birth to age 9 or 10, they do need screening. And that screening can be done not with ophthalmologists, but by pediatricians in the beginning and the school nurses later, the school exams. So that's to pick up any need for glasses, because if they're not corrected when they're very young, then they can get a lazy eye and they can be easily treated when they're young. And if it's not picked up when they're young, later on, even if you give them glasses, they don't see as good with that eye because the other eye takes over. So that's important. That's called a critical period. At age 40, you need to be seen once to see what's going on with your eyes. And if there are no risk factors, maybe every 2-3 years until 54. And after that, every couple of years until 65. And beyond that, every year to pick up diseases. If there are risk factors like diabetes, hypertension, family history of glaucoma, cataracts at a young age, African American race, which predisposes them to glaucoma, then just every year. Diabetes is the commonest disease that impacts the eyes. It's a common disease as such, and it can affect the eyes with bleeding and exudation. So diabetes is the commonest one. And the other ones are hypertension. With uncontrolled hypertension, you can get a stroke in the eye, or strokes or tumors in the brain can show up in the eye. Autoimmune diseases like lupus, rheumatoid arthritis can cause inflammation in the eye, or dryness of the eyes too, autoimmune diseases can cause. So these are the common body problems that can affect the eye. A lot of people think that if they see well, they don't need eye exams. That's probably the worst misconception, because I don't need glasses, so I don't need to go anywhere. And thankfully, in first world countries, it doesn't happen that often, because people do come at some point when they need reading glasses. But it happens a lot in third world countries or in developing countries like India. So if you don't go for any eye exam till 50 or 60 years of age, there are a lot of things that we may have caught earlier, and it's too late to treat, like glaucoma and macular degeneration. So just because you see well doesn't mean you don't need an exam. And if we knew there was a certain exercise that would help, then we would all tell everybody to do it, and none of us would be wearing glasses. But we're not sure, how much or what would help. That's the difficulty, or whether it would help. So, but there's one thing that's been proven, which is that if you spend a substantial amount of time, a couple of hours a day, doing outdoor activities when you're looking in distance, like infinity distance, that might be better for your eye health. Because if you're looking at near work all the time, that might just make your eyes focused at near so much that your reading vision, your near vision gets worse. So I think outdoor activities would help. And then eye exercises, they would do tracking exercises in the past, spend hours doing exercises. It may be good for your if you have headaches, but it's really not going to change the need for glasses. And then during yoga, which I do, you can do some eye exercises, really roll your eyes clockwise, anti-clockwise. Those are good because it releases muscle tension. A lot of headaches and eye aches are all from muscle tension. So I think those are really good, and I do them too. But there's not necessarily to change cataract or glaucoma or physical problems, but they'll be good for muscular problems. So the eye is just one part of the body. The things that can go wrong with the eye, the things that can go terribly wrong are glaucoma, macular degeneration. Really, these are the big things where the vision is lost and you can't do much about it. Those are the terrible diseases. And so both of these are really aging changes in the eye. I mean, glaucoma is usually when the pressure goes up in the eye and it damages the nerve. But sometimes if the pressure goes terribly high, there's no fault of yours, because there's nothing you can do. The drainage system is not working well. But sometimes the pressure is okay, and yet the nerve gets damaged. So what we can do is really all the good health measures: exercise, eat well, lose weight, keep your blood pressure under control, take a lot of antioxidants, green leafy vegetables and carrots. All of those really help your vascular supply to the eye, and therefore your nerve will be a little stronger. And that's the best you can do. Maybe avoid caffeine, and again, exercise regularly. Excessive caffeine can raise the pressure in the eye. If you have 4 cups of coffee, the pressure at that time goes up, not long-standing. And again, with macular degeneration, nutrition has been shown to play a role, a really significant role. We give people with macular degeneration vitamins with the antioxidants. But if you had good diet, all along with antioxidants, such as the foods we know have that would help. And so I think just a good general lifestyle measures and distance activity, keeping in mind that we need to look at distance for a significant period of time. And also screen related activities can dry up the eyes, cause headaches and migraine headaches. So just limit screen related activities to the extent that you can. Healthy eyes that need reading glasses, because beyond age of 40, your lens gets rigid. There are a lot of procedures that are, at least that are coming into the market, but none of them, again, has been proven yet. Probably the best option we have now is we can divide, refractive surgery. It's called refractive surgery, doing any procedure to eliminate the need for glasses, changing refraction of the eye. So you can divide that as cornea-based, which is working on the outer surface of the cornea, doing LASIK and so on, or lens-based, which is working on the lens which is behind the pupil. So corneal-based surgeries, LASIK, it can only correct one focal point, and so you still need reading glasses. Bifocal LASIK has been looked at, but it hasn't arrived there. And another procedure called conductive keratoplasty, where they would really use a probe to just cause some thermal burns and little pinpoint burns in the periphery. It was around for some time, but that didn't work very well. And there are also some procedures where, just like LASIK, you make a flap, but you put a little pinhole. It's called camera. You put a little device there which has a pinhole, and you put the flap back. So you're reducing the pupil size, thereby increasing depth of focus. So they're working on it, but in some places they're doing it, but it's not commonly done in the United States. The camera is one procedure they're looking at. But the best option we have now is a lens-based procedure. So commonly this is done when cataracts are removed, because you're in the eye, in the operating room, you've entered the eye, removed the lens, you move the cloudy lens. You have to put a new lens anyway. So they're working. We have several options of multifocal lenses, crystal lens, which can accommodate a new variety of lenses are coming out called Synchrony. But right now we have multifocal lenses and crystal lens that works pretty good for far and near. They're probably the best, most functional options we have now, but then you need to go into the eye. So usually we do it with cataract surgery. Rarely do we do it when there's no cataract. So when there's no cataract, for younger people in 45, 50, I think we need to wait for the corneal options to be developed a little bit better. They haven't arrived yet. The options to try to get reading and distance, we use contact lenses to do what's called monovision, one eye for far, one eye for near. So that's a lifestyle problem. Glaucoma, when the nerve is damaged, really there's not too much we can do, and they're looking at neuroprotective agents, the same kind that might help people who have had strokes, and they're looking to see whether we can work from the nerve side and protect it. So that's one aspect. And advanced macular degeneration, if they've lost their central vision, we're looking at retinal surgery, where they can put retinal implants and they really have no vision at all. Maybe the implant will give them at least functional vision to movement, so counting fingers kind of vision, we can help them move. So they're looking at retinal surgery when they can move one tissue away, put another tissue in, or put bio-eye, retinal implant with a chip in the brain. None of that will give you great vision, but it's used for people who have no vision at all to give them some vision to get by. So those are the, probably the biggest areas where there might be help.
In our Psych Watch, I'd like to take a look, all pun intended, into eyes as the gateway into one's feelings and emotions. Eyes are a powerful tool for nonverbal communication. You may notice someone's eyes sparkling with joy or brimming with sadness, surprised or afraid, and even welling up with tears. Songs and images describe eyes as laughing, shifty, wild, and even Bette Davis eyes. In Orange is the New Black, a character's name is Crazy Eyes. Women have always sensed the eye's alluring power. They tend to do more to enhance their eyes than men. Cleopatra may have been the mother of eyeliner. She was well known for eye adornment, using kohl to outline and accentuate her eyes. I learned on a trip to Jordan that men would wear kohl eyeliner or guyliner, which is much like football players wear here in the US to help with the sun glare in the desert. In India, women place jewels around their eyes to draw attention to them. In Western culture, we use under-eye concealer, false eyelashes, eyeshadow, eyeliner, and mascara. Ever play a staring game with a friend to see who breaks the stare first? I'm a huge advocate for making eye contact with people at all times when speaking. Continuous eye contact more than 10 seconds may be disconcerting and may make the receiver feel a little uncomfortable. The recipient will inevitably start wondering, do I have spinach in my teeth? Do I need to wipe my nose? Is that guy challenging me? On the other hand, the avoidance of eye contact also sends meaningful messages. Looking away contributes to a sense of psychological distance and may even be a function of anger. You know, the expression, talk to the hand, has become an unspoken subtext because I don't want to even look at you, which has morphed into my new favorite, bye Felicia. In our Quack Quack segment, we've already learned that ophthalmologists are medical doctors, and despite that, some health insurance plans do not cover routine eye exams. Just like dental care and oral health, another essential aspect to health and the ability to perform activities of daily living includes vision. If health insurance is supposed to assist with whole body health, then everything from the eyes to teeth to feet, and even what we can't see in mental health, needs to be treated for everyone. It should not be a luxury. Diabetes is the leading cause of blindness in the U.S. Once again, lifestyle choices impact weight and health. For most people with diabetes, it really is preventable, which means diabetic-induced vision loss is preventable. In February 2016, U.S. Representatives Chris Collins from New York and Jerry McNerney from California introduced H.R. 4642, the Diabetic Disease Prevention Act. This legislation works to prevent blindness and eye diseases associated with diabetes. The politics of health this week is about scope of practice. As in many professions, there is a fine line about education, credentials, qualifications, training, and ultimately protection for consumers, especially when states have licensure for certain professions. In the world of eye health, the increased number of technological devices that perform diagnostic and even therapeutic procedures with little human intervention has created some turf wars. In some states, optometrists have been trying to expand their scope of practice, encroaching on ophthalmologists through legislation. On the flip side, ophthalmologists had a monopoly for decades on corrective vision, not only with prescriptions, but with something called the PD, or pupillary distance, which is a measurement used to correctly make glasses based upon one's facial structure. Consumers were frustrated because they wanted to be able to comparison shop for corrective lenses and frames. With the increase in online shopping, consumer demand is leveling the playing field and allowing more affordable options for corrective solutions. Credentials for professionals, especially in healthcare, should be about training, not about lobbyists or money. The general public ultimately suffers because they are not in a position to fully vet every person they come in contact with. So there is some level of trust based upon professional titles. For those who want to infringe on other professionals, here's my challenge to you. Don't take the shortcut or easy way. Do yourself the favor and get the real, legitimate training you need to perform the services you wish. While you may think you're well-intentioned, you can do harm through lack of proper training. Our myth this week looks at the belief that people who wear corrective lenses for vision are the only people who need to wear protective eyewear for sports. Eye injuries are the leading cause of blindness for children in the United States, and most injuries occurring in school-age children are sports-related. These injuries account for an estimated 100,000 physician visits per year at a cost of more than $175 million. 90% of sports-related eye injuries can be avoided with the use of protective eyewear. Protective eyewear includes safety glasses and goggles, safety shields, and eye guards designed for a particular sport. Ordinary prescription glasses, contact lenses, and sunglasses do not protect against eye injuries. Safety goggles should be worn over them. Currently, most youth sports leagues do not require the use of eye protection. Parents and coaches must insist that children wear safety glasses or goggles whenever they play. Protective eyewear, which is made of ultra-strong polycarbonate, is 10 times more impact resistant than other plastics and does not reduce vision. All children who play sports should use protective eyewear, not just those who wear eyeglasses or contact lenses. Most protective eyewear can be made to match one's prescription. Accidents don't just occur with children. Adults have eye injuries as well. I have to be honest, I once got a paper cut in my eye while doing some paperwork. A friend thought it was appropriate to buy me safety goggles. Who knew that paperwork could be that dangerous? Our tweetable of the week is a little different. We'd love for you to take a photo of yourself with your favorite eyewear and tag us at Vetted Health News, #LoveMyEyes. Now, we'd love to hear from you. We want you to be involved by leaving a comment below or reaching out to us on social media via Twitter or Facebook. The best discussions happen after the episode is over at VettedHealthNews.com. Go there and leave a comment now. Did you like this video? Yeah? If so, subscribe to our channel and share it with your friends. I'd like to end by saying the healthy choice is the easy choice. You just have to make it.